All right, now let's do ABG, arterial blood gas. So how you have to do it? First of all, make sure you explain it properly to the patient that I'm gonna take blood from one of your artery. Usually, preferably, it's gonna be radial artery. All right, and then tell the patient it's gonna feel like a sharp scratch. And you can also mention that I may have to do it once more if I'm unable to get it in my first attempt. You can always ask for any kind of arm preference, whether a patient wants it from the left or the right one. Few things that you can do it, like number one, you can ask if patient has got any kind of fistula, or maybe we have planned for any kind of fistula in the next few days, so better not to touch that arm. Another thing is you should be doing modified Allen test as well, right? Right, let's do modified Allen test. So what we do in this, we tell the patient to make a fist, right? And what we have to do is we have to block both the arteries. So you can see the blood circulation is very good, and we have to block both the arteries, and patient is making a fist, right? So when we block both the arteries, what's going to happen? The hand is going to be blanched, right? So you tell the patient to open the fist and you will see the hand is blanched. Now you will leave the pressure from the ulnar artery but still keep the pressure on the radial one. See what's going to happen? The blood supply will come back, right? It means collaterals are working. It means you are good to go for your ABG test, right? So before you do ABG, make sure you do modified Allen test. Is a ABG syringe. You have got the gauze piece, we have got alcohol swab, and we have got our sharp pen. Open it and see what you have is the syringe and this stop. Put it in the waist area. So that's your syringe. It has got the covering as well. Feel for the pulse. You'll be able to feel the pulse. Then get your alcohol swab. So feel the pulse with 3 fingers. Put your middle finger where you can feel the pulse the maximum, right? Then you clean it once and make sure once you have cleaned, you don't touch that area again, right? Now hold it like a pen, yeah, like a pen, and warn the patient for sharp scratch. And it's going to fill on its own. You don't need to pull the plunger. After that, what you do, you get the swab and put it here. Tell the patient I'm going to take the syringe out, and then what you should do is you will lock the needle like this. All right. So now what you do is you get this out, this needle, and it should go where? In the sharp spine. Don't forget this step. Now you will be able to put the covering here. Now you can label it and make sure you take this sample yourself to the ABG machine that you can find in the wards, specifically in the respiratory ward, maybe in the A&E or in ICU, and get the test done. And if the machine is not working because of any reason, you can put it in the ice box as well and get the test done afterwards. And if the patient is on oxygen, make sure you mention it as well. All right, thank you.